Welcome to Resilience Matters, the podcast dedicated to understanding trauma and building resilience. I'm Dr. Caelan Soma, Chief Clinical Officer at Starr Commonwealth. In this new podcast, join us as we explore the stories, science, and strategies that heal. You'll hear from leading experts in trauma and resilience who are making a difference in children and families' lives every day. Whether you're a teacher, clinician, counselor, or someone on your own healing journey, Resilience Matters is an exciting and engaging resource for hope, healing, and growth. In our first episode, Stress and Trauma in Disguise, I had the pleasure of talking to Amina VanderHyde. Amina has a master's in social work and is a clinical case manager at Starr Behavior Health in Detroit, Michigan. Here she works with children daily to help them build resilience. During our conversation, we discussed what happens when someone experiences stress and trauma, how parents and caregivers can distinguish between normal mood swings and those triggered by stress and trauma, and much more. She shares some really important thoughts on how curiosity leads to a better understanding of a child's needs. Thanks again for listening, and I hope you enjoy our conversation. Amina, welcome.
Hi, thank you for having me.
I'm so happy to have you. Can you introduce yourself to our audience?
Yes, I am a behavioral health clinician at Starr Behavior Health in our Detroit location. And I work with a very talented team of other therapists, and we do a lot of work in the community through partnerships with the school system in Lincoln Park and Children's Hospital of Michigan.
Oh, that's so great. And Amina, you're a master's level social worker.
Yes.
Okay. Yeah. And a certified trauma and resilience specialist.
Yes.
That's great. And actually that is going to help us dive right into our focus for today. We're going to really try to cover, things that other professionals need to know about understanding stress and trauma, and sometimes the overlapping symptomology between stress, trauma, and other things that we often see as behavioral health clinicians in practice, what they're presenting with. So I think to start, it would be really, really helpful to just kind of get a baseline understanding of what happens when somebody experiences stress or trauma.
In definition, trauma, right, it overwhelms our ability to cope. So it overwhelms our system. It is fully systemic, triggering, the parasympathetic nervous system to the point where it has effects all over the body. And also cognitively, we see this in behavior and in our somatic experience, right, and what our body feels. And those two things work together, right? We can't separate them in terms of talking about the impact of trauma.
Right. So when stress and trauma happens, it's really a systemic response, right? Like our body responds and it's involuntary, right? Nothing that we can really do about it, and really overtakes our central nervous system. And so that's why we often hear that stress and trauma are referred to as body or sensory experiences.
Right.
Yeah. Okay. So you kind of mentioned this, but when we see a substantial impact on someone, you mentioned just the inability to cope and even think clearly. Right. So what kinds of symptoms and reactions do you notice?
Well, kids who have a really hard time regulating, they're almost always in their emotional brain rather than their cognitive brain, which, of course, when your child is also not fully developed, so you're still learning how to regulate. And if you've experienced trauma, it makes it that much harder. So oftentimes, particularly in the school setting, I think we see a lot of kids who tend to be disruptive, very fearful, high anxiety, some who would be described as being aggressive, and a number of things that I hear from parents where children experience the full breadth of what we as adults experience when something really, really, really bad happens to us. But we talk about it so differently with children. It's kind of strange on the other side of things.
Yeah, so that's really interesting. So I think what I hear you saying is that you see the result of this impact, the systemic impact in the way kids are showing up. And adults have that same impact from stress and trauma. But with kids, it just looks like it's kind of poor behavior or out of sorts, or they don't really probably have the words to even describe what's going on in their overwhelmed system.
Right, 100%.
Okay. So with the behaviors, that, that makes a lot of sense. Just the aggression, the outbursts, the really disruptive. Do kids ever talk about or mention anything physically that they experience with stress and trauma?
Yeah, definitely. I think it depends on their level of awareness. I feel like that is a big part of the work, is creating bodily awareness for a lot of our kids. I think many of them who've experienced trauma feel very disconnected from their body because of their experiences. But yeah, kids with headaches and stomach aches, especially like attending school, if they already have a really hard time in school, a hard time regulating, they'll get headaches and stomach aches before going to school. We'll talk a lot about the feeling of anxiety, our heart beating really fast, that kind of thing. Yeah.
Wow. It's so telling, because here you're you're mentioning you're a behavioral health clinician, but a lot of the work that you're doing is in, connection or co-treating with folks who are in school settings or in healthcare settings, right? So kids showing up with stomach aches, headaches, kind of those somatic complaints, and then all of those behaviors that educators often say, oh my gosh, this is making it really difficult for kids to learn in school. Wow. So it's like it looks like so many different things, and that's why we titled this podcast, and why we wanted to really talk through this for folks, is that stress and trauma are often really in disguise. Right? It's like the Halloween costume is the stomach ache and the headache, or the Halloween costume is the aggression and, not paying attention or not being able to even articulate the words to describe what they're experiencing. They're just thinking, I just don't feel good.
Yeah.
That disconnect. Wow. So, that kind of leads us into the issue we have, that there's such a high number of kids who are diagnosed with mental health disorders. And then when we dig in and we get to know a child and their family, gosh, so many times we say, wow, you wouldn't believe what happened to this child.
Right.
So let's maybe just talk about how the stress and trauma symptoms and reactions might really look like other mental health disorders, and how even the really smart behavioral health clinician, parent, or educator could mistake those symptoms and reactions.
Right. Yeah, definitely, I think the aggression is a big one that gets mistaken. And then the inattention that comes with experiencing trauma, right? Not being able to focus, like you said earlier. I think that's another one. And of course, when we think about the way that the brain works, inattention as a result of trauma, it works very differently than inattention for, a kid who is diagnosed with a executive functioning disorder. But they present so similarly that it is hard to tell the difference.
So the aggression, let's just take these as examples. So the child who presents with a lot of aggression, how easily we could say, maybe they have oppositional defiant disorder.
Right.
And then you see that inattention or hyperactivity, and you can think, I wonder if my child is struggling with a little bit of ADHD.
Right.
And then you kind of look into wow, well, if they have a systemic overwhelm happening, then of course they feel dysregulated and
Right.
aggressive, or of course they can't focus and pay attention.
Right. Because there's a big difference between not being able to pay attention because your executive functioning isn't operating how it needs to, and you keep having intrusive thoughts or memories or anxieties related to a traumatic experience. So, like for the kid who has experienced something very, very scary, being in a crowded place like a classroom could be very hard for them. It could be overwhelming. It could be triggering, and it could possibly stop them from being as attentive as they could be purely because of their experience, not because they have ADHD.
How easy for any of us as adults to see the behavior, observe those symptoms and reactions, and say, oh, it must be attention deficit related. And so I guess maybe the key here is understanding where the symptoms and reactions are coming from. So you've talked about it a little bit, but it does sound like what we want to kind of get to is, are the behaviors and the symptoms and the reactions we're seeing a result of that systemic overwhelm because of what happened? So how can we be kind of in front of that? I guess just to be curious about things that have happened or may have happened, may have, may continue to be happening.
When working with kids, regardless of what you do, I think being curious is the most important part of working with them, because, kids don't always have the full breadth of experience or language to immediately be able to communicate what's going on with them. So being curious, helping guide them into being able to share their world and what their experience is, I think is really important in general, and especially for parsing out whether or not the impact of trauma is responsible for what you're seeing out of a child's behavior.
Okay. Yeah, that makes so much sense. So really, from the perspective of, let's say, being curious, even with a parent who says, gosh, my child keeps complaining about headaches or stomach aches, or they're just really having a hard time sleeping. Instead of going straight to, oh, is there something physical, a problem? We see that the manifestation is coming out that way, but we might say, like, I wonder when that started, or is this new, right? To kind of get a feel for, like, I wonder what this could be connected to.
Yeah. Well, that makes me think of a point in time I was working with a teenager who had a lot of school avoidance. And, she had such a hard time. And, this is a teenager. She had such a hard time articulating why she didn't want to come to school. She would get, the stomach aches and headaches. Oh, I can't go. And the result, eventually, we kind of, through being curious, figured out she was just feeling a lot of judgment from her peers. And a big part of her past was often being judged by the adults in her life in a verbally abusive manner. And so coming to school created a similar experience for her. It wasn't because she didn't want to be successful, which is how a lot of the teachers and the adults around her treated her, but instead, it was because she felt so much anxiety and so much pain thinking about not only her past, but the people in front of her too.
Oh, wow. Yeah, I love that example, because what it tells us, first of all, is that a lot of times we don't have the words to describe what's happening. And that's definitely part of that system overwhelm that you talk about. And then just sort of being curious and understanding the connections helps you then see her in a completely new way. Right. 100%. So instead of this perception of, like, oh, you don't care, or you just don't want to be successful, it's like, oh, of course you're trying to protect yourself from feeling a way you felt before that did not feel good. Right. So really, she was just kind of trying to do what she knew best to take care of herself.
It is a shame. I think, there are points where I personally get frustrated, right? Because I forget that not everyone is 100% literate in this kind of stuff and the experience of trauma. But for things like that, especially in the school setting, it can be really hard to hear my kids talk about how people just really believe that they don't want to try or they're not good enough or things like that. Or they get written off for, not showing up or not doing their work when they're actually dealing with something really, really big. And if we were curious about it, right, we would know. Of course, we don't all have the luxury to stop and be curious in a school setting, but when you can, it definitely makes an impact.
Makes an impact. Yeah. I mean, so I guess, for parents or for educators who are on the go and moving, well, especially educators have, let's say 25 people that they're trying to, little bodies are trying to keep track of.
Right.
It is like, instead of just assuming, we have to say like, I don't know, I wonder what that's all about.
Yeah.
I wonder if something's behind that or if what's driving that.
I think operating from that perspective helps you also suspend judgment too, which I think comes with, right? And like with the misdiagnosis piece, I think a lot of that is people hoping for a quick fix. They don't want to, necessarily believe that their child is struggling because of something that happened in their past. It may be easier to classify their behavior as ADHD or OD rather than, being curious and opening up that story, which can be painful not only for the child themselves, but for whoever is their support too.
Yeah, that's a really good point. And I think helping to educate that any stress can cause these symptoms and reactions, right? Because, I know that there's a lot of conversation about not wanting to be the one who somebody says your child has experienced trauma. And then as a parent or caregiver, you feel like you did something wrong or you did not protect them or there's something that, you let happen. So I think even framing from the perspective of, any stress, even if it's, hey, she's not comfortable with who she's going to sit with at lunch or who she's going to play with at recess can cause some of that anxiety, which will make you feel dysregulated, I think is important.
Hi, I'm Dr. Caelan Soma, Chief Clinical Officer at Starr Commonwealth. Are you a mental health professional looking to deepen your understanding of trauma and how to help those affected by it? We offer a clinical trauma certification that gives you the tools and knowledge to really make a difference in the lives of the children and families you serve. This program is packed with evidence-based practices and insights from top experts in the field. Whether you're a therapist, counselor, or social worker, this certification can help you support your clients more effectively. If this sounds like something you'd love to dive into, please go to starr.org for more details. It's a great way to invest in your career and positively impact the children you serve. Starr.org, STARR.org. Thanks for listening, and now let's get back to the show.
We've talked a lot about just the confusion that the presentation of these symptoms and reactions and behaviors can bring for any adult. And certainly being curious is a great solution. But if somebody isn't curious and they just assume or they misdiagnose, what are the dangers of misdiagnosis?
Well, I think that the biggest danger is probably that the child will go without support, and which leads to their symptoms being exacerbated, possibly making them more vulnerable in the future, not only to the experience of trauma, but also just all of the systems they interact with.
Absolutely.
And I think, diagnosis is a tool that we use. It is a helpful tool in approaches towards treatment and intervention. But I also think that if we strip it back to the basics, right, we get just the natural piece of human behavior, which is that we do have this reaction to trauma, anything that overwhelms our system or chronic stress. And
that all of us, it doesn't matter how
yes.
old we are, right? It just so happens that we get mad at kids when they're dysregulated, but
100%.
Adults typically can, get in their car and scream or, do something to sort of help manage their symptoms and reactions that's a little bit more accepted by society.
Yeah. And, I think we run the risk of pathologizing behavior that is a normal reaction to something that is usually not okay or not normal to have happen to someone.
Absolutely. Yes. Well, and that makes me think too that we see this reaction that is, of course it should happen. Of course, if something terrible and overwhelming happened, of course you should be nervous and anxious and worried and trying to avoid allowing that thing to happen again. Mm-hmm. And when we're not curious, those symptoms and reactions get punished, right? So we punish and we're punitive and that child thinks something's wrong with them instead of being able to think to themselves, yeah, my body's responding how it should.
Right.
Wow.
I think this is actually, to your point, and going back to how adults have, we get a lot more leeway and autonomy throughout our life and our day. Once you become an adult, there's a lot of things like, I can decide to eat ice cream if I want to for breakfast. When I was a kid, if I tried to eat ice cream for breakfast, I probably would have not fared well because I couldn't make that decision for myself. But as adults, we are able to express ourselves the way that we need or want, but we oftentimes limit our children very, very heavily. And so for children who have experienced trauma and then as a result, have these behaviors that we see as being undesirable or non-compliant or whatever it might be, because it does make it hard to parent and it does make it hard to manage in a classroom. I can't deny that. But when we see that, right, we start with the dichotomy of good and bad. So this is bad behavior. This is good behavior. This is unacceptable behavior. This is acceptable behavior. Mm-hmm. And that can lead to a lot of stigma for a child, impact their self-esteem, which is probably already impacted by the trauma. And again, with misdiagnosis, if we have a particular type of intervention we're using for the diagnosis that we have been given, if it's not working, then there could be consequences where the child is being punished for a very natural reaction to something, again, that they experienced was not natural or normal.
Absolutely. It's like normal response to something that should have never happened.
Right.
Yeah. And it makes me think about the fact that we label or we use the word disorder, right? So traumatic stress disorder. And it's, it gets me thinking, like, is it really a disorder or is it just a traumatic stress response? And, I think there's a lot of controversy about that. And even when kids have a lot of symptomology that looks like an ODD or ADHD, it's like, well, then they're walking around with that label as well. And it's like, well, it's not I have ADHD. It's I have a little bit of hyperactivity or it's difficult for me to focus for whatever reason, either what happened or because of executive function.
Yeah.
We could probably, dig in a little bit to I don't know if you're familiar with the developmental trauma disorder proposed diagnosis.
Yes, I'm very aware.
And it just has not gone anywhere.
No. And it's so unfortunate too, which I think this is a comment on the fact that it had not been accepted, I think is a comment on where we are currently at as professionals with our understanding of diagnosis and human behavior in general. The DSM is a great tool, but it is a double-edged sword. And I think that is also precisely why developmental trauma didn't go anywhere, because it was, according to some critics, far too broad. And we, when we're working from the medical model of like disability or a mental health, we want to be ultra specific, but the reality is that we can't be. We're so multifaceted as human beings that it's just impossible.
Yeah, well, and the complexity of trauma, which, as you mentioned right at the beginning of our conversation, was it is a systemic overwhelm.
Right.
Which means that, so if it's systemic, it means it's physical, it's emotional, it's behavioral, it's psychological, it's all the things, right? So it encompasses everything, which is why developmental trauma disorder makes sense. It's like, well, when a child has developed in the context of stress and adversity, of course they're going to have all these symptoms and reactions.
Most stuff.
Oh my gosh, yeah, that's tricky. Well, it makes me think too that the DSM, like you mentioned, it's another tool, right? And folks always ask me, about doing an assessment, maybe what they would say is a trauma assessment. And, time and time again, I keep thinking we can use assessment tools. We can use the DSM, but the best assessment tool is our own curiosity.
I wholeheartedly agree with that. We as human beings, we seek patterns and to categorize things and make things easy for us to understand and
to tie them up in a bow.
Yeah, refer back to and do what we need to do. It makes things a lot more streamlined in our busy life and our busy world. But slowing down to be curious as an assessment, not only in a formal setting, but also just as we are moving through our lives, I think can be very helpful in general.
Yeah. Well, and I think that's one thing I learned. I mean, after working in the field of childhood trauma for, almost 30 years, I remember the one thing that stands out to me was learning that saying I'm not sure means that you are a curious practitioner.
Right.
If somebody says, what's going on with this child? And you say, I'm not quite sure yet, or I could be based upon all of these different variables. It's like, that is a more, I don't know, just trauma-informed response than saying, oh, I know exactly what's going on with this child and being, all-knowing. So being vulnerable enough and being okay to say, gosh, we're not sure. We have to really investigate and see. I mean, we really have to be detectives when we're doing this work, because unless we're curious, we really won't know what the child needs most.
Oh, yeah. Well, I think that's a really good point, because there are a lot of times where I get imposter syndrome. And because so much of treatment is like me flying by the seat of my pants and responding to the child in real time trying to achieve attunement, engagement, get an idea of their unmet needs and how this factors into the whole child. And so it can be really strange to try and explain to people like how that works and what I'm doing. And I'm not sure comes up not only with, in my assessment of the child, but also, what's going on. Because how do I explain that playing Uno is a helpful tool in trauma therapy? A lot of people walk into that and they're like, you're just playing with a kid. There's so many other things at work.
Yeah, I'm connecting and I'm targeting that nervous system and helping them relax and play and kind of just take a deep breath for a minute, which many of them have not had the opportunity to have.
We all know how important it is to support our kids, especially those who've been through tough times. That's why I'm excited to share something really special from Starr Commonwealth. It's called 1-Minute Resilience Building Interventions for Traumatized Children and Adolescents. This resource is available in print or digitally and is packed with quick, effective strategies for helping kids build resilience and cope with trauma. The best part, each intervention only takes a minute, making it super easy to incorporate into your daily routine, whether you're a teacher, counselor, or parent. These simple yet powerful interventions are designed to make a big impact without wasting time. You'll find practical tips and activities that can help kids feel more supported and empowered right when they need it the most. If you want to learn more and purchase this valuable tool, please go to starr.org/store. Thanks for listening, and now back to our show.
We're going to have to start wrapping up, and
Right.
I just want to mention that, while we don't always know exactly what's happening or know exactly how our treatment should move forward, there are some really key guiding principles that we know are important in doing trauma work. And, I think that would be a great topic for another podcast, just to talk about the many things we can do to create that feeling of safety and connection and relaxation and emotional awareness, those sorts of things. But for our listeners, I guess if we look at just this topic today, and I'm sure we could talk for another hour, what are some key takeaways that you think we want people to know or remember? Maybe just
at the
things.
risk of sounding like a broken record, I think being curious would be the biggest key takeaway here when it comes to approaching trauma and ensuring that it doesn't get mistaken or misidentified for something else. And that it is a whole body experience that impacts every facet of a child's life and their system.
Right. So trauma isn't just in what happened. It's how the child is experiencing what happened.
Right. Exactly.
Yeah. So Amina, is there something that helped you get curious, or how did you know to get curious? Are you just wired that way, or what can people do if they want to get more curious?
Well, I think I am curious by nature, but in terms of education, I went through school not too long ago, but I think a really big part of this journey as a practitioner has been working at Starr too, because they have so many resources when it comes to trauma. And, when I was first, this was before I was hired in, I was an intern. When I was first interning, I went through, all of the different trainings, and I feel like I received a lot because it creates a very solid foundation and baseline to begin to be curious and see things through a lens of trauma, which that doesn't sound great, but see things through a lens of a child's experience and their possible experience of trauma.
Absolutely.
So things like the universal needs assessment or information on private logic and how to explore that with a child, I think were invaluable to me as I was first starting out. And then, of course, I was able to incorporate it into my particular style as a practitioner. But it created a really good basis of knowledge for me to begin operating from a trauma-informed lens.
Yeah, that's really cool. And it just makes me think that, no matter what kind of a practitioner you are, you can get curious within that modality. So let's say you are an art therapist. You can say, can you draw me a picture to, tell me about, what you're best at or who your favorite people are, right? To try to get a sense as to who are they connected to, or do they have any strengths or talents, or enjoyment through play and what's fun for them. And just being curious through those different interventions too.
Yeah.
It's it can be talk, it can be drawing, it could be music, it could be a teacher just saying, hey, what's your favorite book on this shelf? What do you like best? And tell me about why. So that's really cool. I know interventions and tools are so helpful. And I think what I've learned too is that in this work, the more tools you have, the better, because you can just keep pulling and integrating. So when you have the foundation of that curious mindset, then you can pull from what you love to utilize in your practice.
And I think too, it's good to have a lot of tools in your tool belt, because there are days where, I'm exhausted. I'm tired. I've been seeing all sorts of clients, and I have a kid who is just having a really tough day, and I end up having a really tough day with them. And so having my tools helps me keep me grounded, but it also allows me something to fall back on when it comes to intervention. If I'm not 100% there, I always have something that can guide me through a difficult moment.
Yep. It's just that sense of like, okay, that sense of agency in what you're doing. Like, okay, I'm not sure where to go with this, but I have this assessment or activity or tool that I can utilize to help me, take the first step forward.
Right. Yeah, exactly.
Absolutely. Okay. Well, thank you, Amina, for participating and for sharing your expertise and knowledge. This is a really, really important topic. I think that impacts any adult who has a child in their life, so it's important to just kind of take home those messages of knowing that there is significant overlap and then being curious about what could be driving what they're seeing.
Yeah, definitely. Yeah, well, thank you so much for having me. This was fun. I love talking about these things. So
that's
great for me too.
Well, I'm sure we'll have you back.
Yeah, I would love that. Thank you.
Okay, thanks, Amina.